Seniors, stop sleeping in this position immediately. It's slowly straining your heart. Hey there, I want to start by asking you a simple question. How do you sleep at night? Are you getting a full, restful night's sleep? Or do you find yourself tossing and turning trying to get comfortable? Now here's something you may not have considered. The way you sleep might be silently harming your heart. Yes, you heard that right. What if I told you that the sleep position you've been using for years, something you've likely never given much thought to, could actually be putting unnecessary strain on your heart? It's not about what you eat or how active you are during the day, and it's certainly not about your age. It's about something much simpler, how you position your body when you sleep. I know this may sound surprising, but the truth is that some sleep positions, especially for seniors, can exacerbate cardiovascular problems, increase blood pressure, and lead to poor circulation, all while you're trying to rest and recover. The worst part, many of us don't even realize that these habits are slowly affecting our heart health until it's too late. But don't worry, I'm not here to scare you. I'm here to help you take control of your health and make small, simple changes that could make a huge difference in the long run. In this video, we're going to explore the sleep positions that can be damaging to your heart. And more importantly, I'll show you the right positions to adopt that will help improve circulation, lower blood pressure, and protect your heart from unnecessary strain. So if you're ready to learn how something as simple as how you sleep can make a world of difference for your heart health, stick around. By the end of this video, you'll understand the crucial connection between sleep posture and heart health, and you'll know exactly what to do to make sure your sleep is working for you, not against you. Let's dive in. Number 1. Understanding the connection between sleep and heart health. Before we dive into why certain sleep positions can harm your heart, it's essential to understand how sleep and heart health are connected. You may not realize it, but how you sleep can actually influence your blood circulation, heart rate, and even your blood pressure. Let's take a closer look at the science behind sleep and how it directly impacts the heart. How sleep affects your heart. Sleep is more than just a time for rest. It's when your body does its essential recovery work. During sleep, your heart rate slows down, your blood pressure drops, and your circulatory system gets the chance to rest and restore itself. But if you're in a poor sleep position, this process can be disrupted, leading to increased strain on the heart. Blood circulation. When you're asleep, your body requires good blood circulation to ensure that oxygen and nutrients reach all your organs, including the heart. If your sleep posture restricts circulation, say by compressing the chest or restricting airflow, it can place extra pressure on the heart, making it harder for the blood to circulate efficiently. Blood pressure. Poor sleep positions can also affect blood pressure regulation. For instance, sleeping in positions that restrict breathing or increase body pressure can lead to higher blood pressure during sleep. Over time, this increases the risk of developing hypertension, high blood pressure, which is a major risk factor for heart disease. Heart rate and oxygen supply. When you're in an uncomfortable sleep position, your body might struggle to relax fully. This causes your heart rate to stay elevated, and the body has to work harder to maintain normal functions. This can create unnecessary strain on the heart and reduce the amount of oxygen available to organs like the heart. Sleep and the aging heart. As we get older, our cardiovascular system becomes more vulnerable. The heart tends to lose some of its flexibility, and the blood vessels become stiffer. This makes optimal blood flow even more critical for heart health. If your sleep posture doesn't support good circulation, it may worsen these age-related changes, putting more stress on your heart. For seniors, sleep can be a double-edged sword. On one hand, it's a vital time for recovery, but on the other hand, if the heart and circulatory system aren't getting proper support during sleep, it can lead to long-term cardiovascular issues. Understanding how sleep affects your heart is the first step toward improving both your sleep and your overall health. Number 2. The heart's vulnerability as we age. As we age, our bodies undergo natural changes that impact our cardiovascular health. These changes make it even more important to be mindful of how we sleep. For seniors, the heart is more vulnerable to strain during sleep due to various factors that affect the cardiovascular system as we age. 1. The aging heart reduced efficiency and flexibility. As we get older, our heart muscles become less efficient at pumping blood, and the blood vessels lose some of their flexibility. This makes it harder for the heart to respond to sudden increases in blood flow or pressure, both of which can occur during sleep if your body is positioned incorrectly. Stiffening arteries. Over time, arteries become stiffer and less able to expand and contract effectively. When you sleep in a way that restricts blood flow or puts pressure on your arteries, the body may not be able to compensate as easily, leading to higher blood pressure and increased heart strain. Increased risk of blood clots. Poor circulation during sleep can also contribute to an increased risk of blood clots. Seniors are already at a higher risk for blood clot formation, and inadequate circulation due to improper sleep posture can make this risk even greater. Blood clots can eventually lead to stroke or heart attack, both of which are significant risks for seniors. 2. Hypertension and sleep posture. Another common condition that worsens with age is hypertension, high blood pressure. As we get older, the walls of our arteries naturally become thicker and less elastic, which can increase resistance to blood flow and raise blood pressure. During sleep, especially if you're in a poor sleep position, your blood pressure may stay elevated, placing additional stress on the already weakened heart and blood vessels. Sleep posture and blood pressure. Sleep positions that put extra pressure on the heart or restrict the flow of oxygen can worsen hypertension. For example, sleeping in positions that compress the chest, such as sleeping on your stomach, can interfere with both the circulatory system and respiratory system, causing a spike in blood pressure and increased workload for the heart. 3. Heart failure and poor sleep positions. Heart failure is another common condition in seniors, where the heart becomes less efficient at pumping blood throughout the body. Seniors with heart failure need to be extra careful about how they sleep because improper sleep posture can worsen symptoms. Fluid accumulation. In heart failure, the heart struggles to pump blood efficiently, leading to fluid buildup in the legs, abdomen, and sometimes the lungs. Certain sleep positions can exacerbate fluid retention, increasing pressure on the heart and making it even more difficult for the body to process excess fluids. Sleep positions that make heart failure worse. Sleeping on your back or in positions that make breathing harder can aggravate heart failure symptoms. For instance, lying flat on your back can cause fluid retention in the lungs, making it harder to breathe and placing additional strain on the heart. Number 3. The worst sleep position for heart health. Why you should stop sleeping on your stomach. Now that we understand how sleep affects heart health and how aging impacts our cardiovascular system, it's time to talk about the worst sleep position for your heart: sleeping on your stomach. While it might be a comfortable position for some, it's a position that places unnecessary strain on the heart, lungs, and circulatory system. Let's break down why sleeping on your stomach is one of the most harmful positions for your heart and why you should stop sleeping in this position immediately. Why stomach sleeping is harmful to your heart. Increased pressure on the chest. When you sleep on your stomach, you essentially put direct pressure on your chest, which can make it harder for your lungs and heart to function properly. This added pressure restricts the ability of the diaphragm, the muscle responsible for breathing, to fully expand, leading to shallow breathing and less oxygen intake during sleep. Impact on circulation. The compression of the chest wall and diaphragm can reduce the efficiency of your blood circulation. This places strain on the heart as it has to work harder to circulate blood throughout your body, including oxygenated blood to your vital organs. Breathing difficulties. With the diaphragm restricted, the body struggles to breathe more deeply, which can result in shortness of breath or even disrupted sleep due to constant shifts in breathing patterns. Neck and spine misalignment. When you sleep on your stomach, your neck is often twisted to one side, which places unnecessary strain on the spinal column and neck muscles. This misalignment can lead to muscle stiffness, nerve compression, and even chronic pain over time. Increased stress on the heart. This misalignment also affects your nervous system, which is responsible for regulating many functions of the heart and circulation. The nerves that help control heart function run through the neck and spine, so improper alignment can increase strain on your cardiovascular system. Pressure on the organs. When lying on your stomach, your internal organs, particularly your lungs and heart, are compressed. This can cause both breathing issues and blood flow complications, making it harder for the heart to pump blood efficiently. Reduced heart efficiency. The pressure from the stomach position can compress the chest cavity, reducing the amount of blood the heart can pump per beat, especially in seniors who may already be dealing with weakened heart muscles. The added strain can lead to increased blood pressure and poor circulation. What happens when you keep sleeping on your stomach? Sleeping on your stomach not only causes immediate discomfort, but the long-term effects can contribute to chronic cardiovascular strain, including an increased risk of hypertension, poor circulation, and in severe cases, heart-related conditions. For seniors, the risks are even higher as the heart is already more vulnerable due to age-related changes. Stomach sleeping can accelerate the deterioration of heart health, affecting blood pressure regulation, heart rate variability, and overall cardiovascular function. Number 4. Better alternatives. The healthiest sleep positions for your heart. If you're ready to make a change for the health of your heart, it's time to ditch stomach sleeping and adopt heart-friendly sleep positions. The good news is that simple adjustments to how you sleep can make a significant difference in improving circulation, lowering blood pressure, and reducing strain on the heart. Let's explore the best sleep positions for your heart health. 1. Sleeping on your back. The most heart-friendly position, sleeping on your back, is considered one of the best positions for heart health. Here's why. Neutral spine alignment. Sleeping on your back allows your spine to remain in a neutral position, which means no added pressure on your internal organs. This provides the optimal environment for better circulation and easier breathing. With no body weight pressing down on the chest or diaphragm, your heart can beat more efficiently without unnecessary strain. How it benefits the heart. By sleeping on your back, you reduce the pressure on your heart and lungs, allowing for more effective blood circulation. This position also helps prevent the airways from becoming constricted, which can improve oxygen levels in the blood and promote overall heart health. Tips for sleeping on your back. Use a pillow that supports the natural curve of your neck and spine to prevent any strain. Avoid sleeping with your head elevated too high, as this can put pressure on the neck and throat, reducing airflow. 2. Sleeping on your left side. The heart-boosting position. Another excellent sleep position for the heart is sleeping on your left side. This position is especially beneficial for people with heart conditions or those who want to support optimal blood flow. How it benefits the heart. Sleeping on the left side can enhance blood circulation to the heart. The aorta, which is the large blood vessel carrying oxygenated blood from the heart to the rest of the body, naturally curves to the left. Sleeping on this side can help gravity support blood flow and reduce the amount of work the heart has to do to pump blood. Digestive and heart health. The left side sleeping position can also help reduce symptoms of acid reflux and heartburn, which are common in seniors. By positioning the body in this way, you encourage better stomach drainage, allowing the heart and digestive systems to work more effectively. How to sleep on your left side. Use a pillow to support your head and neck to ensure proper alignment. If you tend to roll onto your back or stomach, try using a body pillow to gently keep you on your left side during the night. 3. Sleeping on your right side. A less ideal, but better option than stomach sleeping. If you find that sleeping on your back or left side is uncomfortable, sleeping on your right side is still a better option than sleeping on your stomach. It's not as heart healthy as the left side, but it's far better than the pressure and restrictions caused by stomach sleeping. How it benefits the heart. The right side sleeping position places less pressure on the heart and lungs than stomach sleeping does, which is why it's considered a better alternative. However, it doesn't support the optimal blood flow to the heart as much as the left side does. How to sleep on your right side. Again, use a comfortable pillow that supports the neck and maintains spinal alignment. Tips for transitioning to healthier sleep positions for seniors who are used to sleeping on their stomachs. Making the transition to a heart-friendly sleep position may take time. Here are some practical tips to help you make that switch. Use body pillows. If you're trying to get used to sleeping on your back or side, body pillows can help support your body and keep you from rolling back into your old sleep habits. Adjust your mattress. Ensure your mattress supports proper spine alignment. A medium firm mattress is typically recommended to maintain neutral alignment without causing discomfort. Start slowly. Try transitioning to your new sleep position gradually. If you're used to stomach sleeping, It may feel strange at first, but with patience, your body will adjust. Number 5. Tips for improving your sleep posture and overall heart health. Now that we've covered the best sleep positions for your heart, let's dive into some additional tips for improving your sleep posture and overall heart health. These simple adjustments can help maximize the benefits of your new sleep position and create a more heart-friendly sleep environment. Invest in the right mattress and pillows. Your mattress and pillows play a huge role in maintaining proper spinal alignment and ensuring that your heart and other organs aren't under unnecessary pressure during sleep. Firmness matters. If you're sleeping on a mattress that's too soft or sagging in the middle, your spine and chest may not be properly supported. This can lead to poor posture and increased pressure on your heart. Medium firm mattresses tend to offer the best support for seniors, as they help keep the spine aligned without putting pressure on the chest. Pillow support. Using the right pillow can make all the difference in maintaining a healthy sleep posture. Memory foam pillows or contour pillows are great options as they mold to the shape of your neck and head, helping to keep the spine and airways open. If you're sleeping on your back or side, ensure that your pillow keeps your neck and head in a neutral position to avoid unnecessary strain. Pillow between the legs. If you're sleeping on your side, place a pillow between your knees to help maintain hip alignment and avoid twisting your lower back, which can impact circulation and lead to discomfort. 2. Create a comfortable sleep environment. Your environment can also influence how well you sleep and in turn how well your heart functions. A relaxing, comfortable sleep setting promotes better sleep quality and reduces stress, a key factor in heart health. Temperature control. Keep your bedroom at a comfortable, cool temperature. A cooler room helps you sleep more deeply, and good sleep is essential for heart health. Avoid overheating during the night, as this can interfere with your body's natural recovery processes. Quiet and dark. A quiet and dark sleep environment is vital for getting restful sleep. Use blackout curtains or an eye mask to block out light, and consider white noise machines or earplugs if noise is an issue. Good sleep hygiene is essential for maintaining healthy blood pressure and heart function. Avoid electronics. Before bed, the blue light from phones, tablets, and computers can interfere with your body's natural production of melatonin, the sleep hormone. Try to avoid screens at least 30 minutes before bed to allow your body to wind down properly. 3. Incorporate relaxation techniques. Before bed, consider incorporating some relaxation techniques to help calm your mind and body, making it easier to settle into a heart-healthy sleep position. Techniques like deep breathing or meditation are excellent tools for reducing stress and lowering your heart rate. Deep breathing, slow breathing exercises can help relax the nervous system and lower blood pressure. Try breathing in for 4 seconds, holding your breath for 4 seconds, and then exhaling for 4 seconds. This simple exercise can help relax your muscles and calm your heart rate before sleep. Gentle stretches or yoga. Some seniors find that gentle stretching or yoga helps relieve tension in the body, especially in the back and neck. This can make it easier to fall asleep and help maintain a more comfortable and heart-friendly sleep posture. Number 6. The impact of sleep hygiene on heart health. While sleep position is crucial, the overall quality of your sleep and the habits you maintain to ensure a good night's rest also plays a significant role in protecting your heart. Let's take a closer look at sleep hygiene and how improving your overall sleep routine can enhance your heart health. 1. Establish a regular sleep schedule. The body thrives on routine, and your heart is no exception. Having a consistent sleep schedule can improve the quality of your rest and help regulate your blood pressure and heart rate. Irregular sleep patterns can disrupt your circadian rhythm, leading to increased stress, higher blood pressure, and a greater risk of cardiovascular problems. Go to bed and wake up at the same time. Try to keep your bedtime and wake-up time consistent, even on weekends. This helps regulate your internal clock, improving your body's natural ability to fall asleep and wake up. Consistency in your sleep schedule can help stabilize your heart rate and promote optimal heart health. 2. Avoid stimulants before bed. Caffeine, nicotine, and heavy meals late at night can all interfere with your ability to fall asleep, leading to restless sleep and increased stress on your heart. To improve your sleep hygiene, it's important to limit these stimulants in the hours leading up to bedtime. Limit caffeine and alcohol. Avoid caffeinated beverages, like coffee, tea, or soda, and alcohol several hours before bed. While alcohol might make you feel drowsy at first, it can disrupt the deeper stages of sleep, leaving you feeling unrefreshed and adding extra stress to your heart. Avoid heavy meals. Eating large heavy meals close to bedtime can cause digestive issues that disrupt your sleep. Try to finish eating at least 2 to 3 hours before you go to bed to give your body enough time to digest your food. 3. Create a bedtime ritual. A relaxing bedtime ritual signals to your body that it's time to unwind and prepare for sleep. This could involve a series of calming activities that help lower your heart rate, reduce stress, and prepare your mind for rest. Bedtime activities. Consider reading a book, taking a warm bath, listening to soft music, or practicing relaxation techniques like guided meditation or progressive muscle relaxation. These activities can help you shift your focus away from the day's stresses and ease your mind into a calm, restful state. 4. Address sleep disorders. If you're struggling with sleep disorders like sleep apnea or insomnia, it's essential to address these issues with the help of a healthcare provider. These disorders can significantly impact your heart health over time, especially if left untreated. Sleep apnea and heart health. Sleep apnea causes interrupted breathing during sleep, leading to periods of oxygen deprivation. This can increase heart rate and blood pressure, putting additional strain on the heart. If you experience snoring, gasping for air during the night, or excessive daytime sleepiness, consult a healthcare professional for proper diagnosis and treatment. Wrapping up, by improving your sleep posture, adopting a consistent sleep schedule, and maintaining a heart-healthy sleep routine, you can significantly reduce strain on your cardiovascular system and enhance your overall well-being. Simple changes in your sleep habits can help ensure that you wake up feeling refreshed and your heart remains strong and healthy. In the final section, we'll summarize how adopting the right sleep positions, sleep hygiene, and relaxation techniques can promote better heart health and a better night's rest for seniors. Stick with us to learn how you can protect your heart while getting the best sleep possible. Number 7. Consistency is key. How small changes can lead to big results. Now that we've explored the best sleep positions and how sleep hygiene affects heart health, let's talk about the importance of consistency. Implementing the right sleep practices and maintaining a heart-friendly posture might not yield immediate results, but sticking with these changes over time will lead to long-term benefits for both your heart and overall well-being. 1. Creating a sustainable sleep routine. Making lasting changes in how you sleep doesn't mean you have to be perfect every night. The goal is to create a routine that works for you and can be maintained over time. Even small shifts in your sleep posture can make a significant difference when done consistently. Sleep position. Start by making small adjustments to your sleep position. If you're used to sleeping on your stomach, try gradually transitioning to back sleeping or side sleeping. It may feel uncomfortable at first, but with persistence your body will adjust. You can use pillows or a body pillow to support the transition. Set goals and track progress. If you're not used to sleeping on your back or left side, consider keeping a sleep journal to track your progress. Note how you feel in the morning. Do you wake up with less heart strain or fewer muscle aches? This can help keep you motivated and focused on your goals. 2. Reassess and adjust your sleep habits. It's important to reassess your sleep habits periodically. Are you still waking up feeling rested and without the same level of heart strain? If not, consider making further adjustments. The key is to stay consistent with good sleep practices, but don't be afraid to adjust your approach if something isn't working. Sleep environment. Make sure your sleep environment remains conducive to heart health. Comfortable bedding, optimal room temperature, and minimal distractions are key to getting the best possible sleep. As you refine your routine, ensure your mattress and pillows are supporting you correctly. Relaxation techniques. If you're not already incorporating relaxation exercises into your bedtime routine, now might be a good time to do so. Meditation, deep breathing, or gentle yoga can go a long way in improving heart health and overall sleep quality. 3. Patience and long-term heart health. Remember that heart health is a long-term commitment. You might not notice changes overnight, but over time, sticking to healthy sleep habits will help you feel more energized, reduce strain on your cardiovascular system, and allow your heart to function more efficiently. If you're struggling to adjust your sleep posture, it's okay. Don't get discouraged. These things take time, and even a small change in position or habit can make a big difference in the long run. The key is to stick with it, and over time you'll start to see the benefits. Conclusion: prioritize your heart health by sleeping smarter. We've covered a lot of ground today, but the main takeaway is clear: how you sleep matters, and it matters even more as we age. Your heart is at a higher risk of strain and complications as you get older, but with some thoughtful changes to your sleep habits, you can significantly reduce that risk and protect your cardiovascular health. Here's a quick recap of what we've learned. Stomach sleeping is the worst sleep position for heart health, as it places unnecessary pressure on your heart, lungs, and diaphragm. It restricts circulation and makes breathing more difficult. The best sleep positions for your heart are sleeping on your back or on your left side. These positions promote optimal blood flow, reduce pressure on the heart, and support better lung function. Improving your sleep posture isn't just about comfort. It's about reducing strain on your cardiovascular system, enhancing blood circulation, and allowing your heart to function more efficiently while you rest. The right mattress and pillows, along with a relaxing pre-sleep routine, can also help improve your heart health and sleep quality. Consistency is key. Making gradual adjustments to your sleep habits will lead to long-term benefits for your heart and overall well-being. Remember, small changes in your sleep habits can make a big difference in your heart health. Prioritize your heart by ensuring that you sleep in a position that supports your cardiovascular system, helps you relax, and allows you to wake up feeling refreshed and energized. Thank you for watching, and I hope you feel empowered to take charge of your heart health tonight by making some simple changes to your sleep routine. Like, comment, and subscribe for more tips on healthy aging, heart health, and improving your overall well-being. Take care of your heart, and it will take care of you.